Hello, good afternoon. This is Chuck of Snowspirations Global Health Solutions, Dr. Chidi Ufondo, and it's a very good opportunity to touch base before the event we have tomorrow. So today's clinic is going to be predominantly more of a countdown to our combined fertility and pregnancy masterclass tomorrow. If you remember, every last Sunday of the month is devoted to our masterclass. Our masterclass is a special class during which you can gain a lot of insight in a particular problem. So the month of October, we've actually devoted to fertility and pregnancy. So the essence of today's clinic is pretty much to give you a stepwise approach on what you need to do if you want to participate in the event tomorrow. And of course, if you have any questions in regards to getting ready, you can feel free and ask your question. So thank you so much. I appreciate you joining me. Remember to set your notifications every Tuesdays, 6:30 p.m. Eastern Time, then every Saturdays, 3:30 p.m. Eastern Time. From November the 5th, in America and a couple of other places, there will be a couple of changes in time. So we're going to fall back in Sunday. So you need to keep all these into account anytime you're coming up to check for any publication. So fertility, it's something that is naturally given to everybody. So as a woman, God already gave you your fertility intact. So you're born a mother. Now, because you're in the world, you're going to have challenges. You're going to encounter some temporal challenges. You're going to encounter some lifestyle challenges. Of course, the biggest factor in a woman's life is the age. So as you're getting older, a couple of things will start changing based on what God already gave you. So your body will start changing, especially the eggs that God already gave you, which is called the ovarian reserve. By default, as you're getting older, the quantity and the quality of the eggs will keep dropping until you come to a stage when you will no longer have eggs. That stage is a state that every woman is going to get to. So what we're going to do tomorrow during the masterclass is to identify the individual fertility factors in men and also identify the individual fertility factors in women. Then we address them. So we don't just find problems, we also find solutions. So tomorrow we have two presenters, myself and Dr. Odega, who is a fertility expert. We're going to look at the male aspect of fertility. We're going to look at the risk factors that will likely cause a man not to impregnate the woman. Then we're also going to look at the likely factors that will affect a woman not to get pregnant. So it's going to be male factor, female factor. Together, we're going to have a consensus. So it's up to you to show up and address the need to starting your family. October is going to end very soon. The question is, have you succeeded in becoming pregnant? Have you succeeded in becoming a mother? Have you succeeded in becoming a father? You see, when you compare yourself to other people and you're just dwelling on the ephemeral physical comparisons, but you're not putting in the works, you are wasting time. The best way to compare yourself with other people is to take all the actions you need to take so that by the end of the day, you can say, I've done my best. So the big question I'm going to ask for people that are still having delays in becoming pregnant and starting their families, have you done your best in the month of October? Have you done your best in 2023? Have you done your best since you started? Do you think there are things you need to do differently? Do you think you're just at your good? You haven't done your better. You haven't even done your best. What do you think you can do differently, even as of today, even as of this clinic, to get the help you need? So these are the factors we're going to address. So I will personally take care of the male aspect of infertility. So I've already finished my presentation, actually shared my presentation with COO, and it's something we discuss pretty much every day. But I've been able to classify them into steps that will help the men. You see, in our society, everything is all blamed on the women. Oh, it's the woman, go and sort yourself out. But it's no longer that way. 30% of the reason why we might not have some families with their kids come from the men. 30%. The other 30% will come from the women. So 30 plus 30 is 60, right? Now, the other 40% is shared equally between men and women. Then there is a category we call unexplained infertility. So we also need to talk about the men. So please, when you're coming tomorrow, come with your male partner. You see, in our group is predominantly all about helping women to become mothers and helping women to have their babies. So it's a maternal and child health hub. Now, your relationship might be boy and girl relationship, but you guys want to have kids, and I'm going to teach you how to have kids. Your relationship might be that of wife and husband. We're going to teach you how to have kids. Your relationship might be single mother or single father. So long as you want to have a baby, we're going to teach you the right things to do. So our group is not a moral instruction group where we can say, oh, you have to go and marry before you do this. That's not what we do. We teach you what you need to know so you can overcome. So what we're going to teach you tomorrow is very important. If you have analyzed your journey in 2023, I'm going to give you 2 age categories. If you're a lady, the focus of age is on the women, not the men. Men have a lot of cushioning effects. So I'm more worried about women. Now, if you're in this gathering, we have 6 people in the clinic. If you are not yet pregnant, but you have been pregnant in the past, but currently you're not able to achieve pregnancy, you have secondary infertility. In secondary infertility, for a period of 12 months or 6 months, you are not able to achieve pregnancy again. But you achieved pregnancy in the past. But in this current dispensation, pregnancy is getting difficult to achieve. You have secondary infertility. Secondary means you were previously pregnant. You had your baby, you miscarried, you had stillbirth, but currently you're now having problems. So that's one classification of infertility. Secondary infertility. Primary infertility means since you started making love with your current partner, with your previous boyfriend or whatever, you have never tested positive in your life. That one is more difficult to handle. Now, primary infertility can happen to women. Primary infertility can happen to men, but mainly the women, because women are the ones that carry the baby. So some men can just be making love up and down, impregnating women here and there, but because the man will not be the person that will go and ask the girl, oh, did you get pregnant for me? He might not really know if he was able to impregnate a woman. But women will know if you make love without protection and you are not able to become pregnant, you have never been pregnant in your life, you should be worried. It's primary infertility. It's very difficult to handle. Now, when we begin to now conquer down, we are going to divide infertility broadly into 2 categories based on age. So infertility is the inability to succeed in becoming pregnant or to succeed in getting your woman pregnant for a period of 12 months, 12 consecutive months. So 12 consecutive months means if you started wanting to get your woman pregnant in January, and your woman is age 30, by December, if you did not succeed in getting her pregnant, if she did not succeed in getting pregnant, you guys have infertility. So the cutoff point is 35. If you are below 35, you should have practiced PPP for 12 consecutive months. At the expiration of the 12th month, that particular condition will now be classified as what? Infertility. It can be primary or it can be secondary. Now, if you are above 35, instead of 12 months, we're going to reduce it to 6 months. So assuming you're 40, and since January, you've been a staunch member of our community, you make love every 48 hours, you pray to God, you practice, you exercise, you have a fertility specialist. Now, if you started in January, by July, you have infertility. So these are the factors you should know at your fingertips so that when you equip yourself with this knowledge, you can break the backbone of infertility. Infertility is a temporal situation. It's something we can defeat, but you need the right knowledge, you need the right attitude and the right practices and perception to defeat infertility. If you lack the knowledge, your attitude will be negative. When your attitude is negative, you're not going to practice better. When you're not practicing better, your perception will be wrong. When your perception is wrong, you will get yourself stuck in the same place. I don't want you to get stuck in 2023, carrying it over to 2024. I want you to overcome. So that's what we're going to discuss tomorrow. So keep a day with us tomorrow. And please make sure you show up on time. We're going to have a full house. Admin will be fully in attendance. COO is going to be there. Dr. Ndiche is going to be there. Chinyere is going to be there. Onyi is going to be there. So standard, all the crew of SGHS will be there. Then, of course, all our patrons, all the women that have been so supportive, all the women that have been helping other women to attend, they will attend as observers free of charge. So likes of Esther, likes of Ngozi, Zero James, Chinonso, and I think there's another lady I awarded free attendance. They will all attend freely. Now, what I want you to do before I start taking care of your questions, if you're led in the spirit, this group is a place you can find love. You see, our joy will not be complete if few women become pregnant and many women are not becoming pregnant. Our joy will be complete when I will show up in a clinic and everybody in the clinic has already succeeded in becoming pregnant. So if you're coming tomorrow, try and bring someone by sponsoring them. People you don't know. Try and tell admin, you know what, I'm going to take care of 10 people. I'm going to take care of 5 people. I'm going to take care of 2 people. Or worst case scenario, 1 person. Don't come alone if you are blessed. So I'm going to open the clinic now, and I'm going to give you an opportunity to ask your questions. You probably have about 5 minutes to do so. So ask your questions, and admin, please, I want us to ask all questions right now. So I can see Dr. Ndiche. Dr. Ndiche, I want you to also ask me questions. I just don't want anybody to be in the clinic and they're not participating. We have only a few people. So Dr. Ndiche, go ahead and ask me questions. Chinyere, ask your questions. And I think Oluchi Okeke is asking about the time, 9 p.m. Nigerian time. I want you to start getting ready from neighborhood of 8:45. By 8:45, we open the studio. We'll start making sure that things are done properly. Of course, you have to remember that registration ends today. Once it's end of business day today, registration is ended. Please, I don't want you stressing us tomorrow. It takes a lot of things to, feed you guys the links you need and to address everybody's problem. To avoid all that, we all adults. Please make sure you finish everything today so that by tomorrow, COO will have some time for herself. I will have some time for myself to give you guys the best. But right now, please start asking your questions. Immediately after this clinic, join me in Facebook. I'm going to repeat exactly this same clinic in Facebook for 30 minutes. So the clinic is open now. Start asking your questions. Do we have anyone that has questions? Feel free to ask your questions. It's time for your questions. Okay. If a couple have done everything they could to achieve pregnancy without any positive result, what's the next option? It depends on what they mean by everything. So I'm going to assume that everything means they've tried a natural way of becoming pregnant. It didn't happen. And they've qualified as couples that have infertility. So the age of the woman is very important to me. So for example, if the woman is 25 and for the past 12 months, she's been doing the right things and she's not able to become pregnant, and you're telling me they've done everything right and everything is okay, then they have unexplained infertility. So in unexplained infertility, we've done everything. We've checked the woman is perfect. We've checked the man is perfect, and they're making love and pregnancy is not happening. You have unexplained infertility. For unexplained infertility, we would have done everything regarding assessment of the man, regarding assessment of the woman, and still they are not able to achieve pregnancy. When you find yourself in that situation, you need to go for stepwise management under the care of a fertility specialist. So what do you need? When you present to the fertility specialist, first of all, we're going to take your history. We're going to check some basic parameters. Then afterwards, we're going to start you with fertility drugs. Common fertility drugs like Clomid or all those common ones out there. We're going to see how you respond to that. Then if pregnancy doesn't happen with the medications like Clomid, we're going to step up our game. So the next thing we're going to do is to go for IUI. IUI simply means intrauterine insemination. In intrauterine insemination, what do we normally do? Most times it's for men that have male factor infertility. We'll collect the sperm. We'll make sure the sperm is good quality. We'll make sure the woman is ovulating. Then we'll introduce the sperm right into the womb. The idea is to create an avenue for the sperm to get direct access to the womb so they can swim to either of the tubes to get pregnancy started. That's IUI. Now, we can do IUI with the person's natural cycle. So if she's ovulating, we'll make sure we target the right time she's ovulating. Then we introduce the sperm hoping that the sperm will go and fertilize the ovulated eggs. If the natural cycle is not working, we use ovulation induction method. So ovulation induction method mediated IUI simply means we're going to give the woman ovulation induction drugs like clomid. Then we're going to target the time the woman will ovulate that particular egg. Then we're going to introduce the sperm, hoping that it's going to lead to fertilization. When fertility drugs fails, when IUI with natural cycle fails, when IUI with ovulation induction fails, the next thing to do is what? IVF. IVF is the last option for people that have unexplained infertility. In IVF, what do? We are going to handle the eggs outside the body of the woman. We are going to handle the sperm outside the body of the man. So we're going to make some changes in the way the body of the woman is working. We give her some drugs to stimulate the ovaries. We tell the ovaries to give us a lot of eggs. So it's no longer going to be one. It's going to be super ovulation. So when we collect the eggs, we'll collect the sperm. We make sure that both of them are good quality. We join both of them together in the lab. In the lab, both of them will come together to form embryo. When they form the embryo, we now go back and introduce it back into the body of the woman. Once we introduce it back into the body of the woman, in 2 weeks, 14 days, we are going to run a test. And by the special grace of God, it's going to be positive and the woman is pregnant. So this is the stepwise way to manage people that might have unexplained infertility. I love that question. Okay. Is there hope for a woman in her 50s to still be a mother? There is always hope. Hope is a renewable commodity. Once you're a woman, I want you to follow 2 terminologies that are used interchangeably. There's a difference between a woman and a mother. Now, some women will become mothers without becoming pregnant based on their age, based on the natural, steps, the natural milestones. There are certain things that will happen to women until they die. When they give birth to you in this world, you're not going to start having that possibility of becoming pregnant until you come of age, you enter puberty, you start bleeding. The moment you start bleeding as a girl, you can become pregnant. Now, that stage will come and go. You pass from your teens, you enter your 20s. Your 20s is when you have all the best potentials to become pregnant. If you succeed in becoming pregnant, good. Now, as you're getting older, things will begin to change. So a woman at 50 can be a mother, depending on her own individual status. She still has a tiny window of becoming a mother naturally, if she has any egg remaining. But the possibility of becoming a mother naturally at 50 is like finding a needle in a haystack. But it's possible. There are few women that became pregnant naturally at 50. But the best way for this lady at 50 to become a mother is to go for donor egg, donor sperm IVF. Number 1 option. Number 2 is to go for surrogacy. Surrogacy means we're going to find another woman who is going to be the mother for the baby until the baby is born. And the third option is adoption. So for this woman at 50, of course, you can still become a mother at 50 naturally, assisted reproductive technique using donor egg, donor sperm, surrogacy, and adoption. Those are the ways you can become a mother. Now, understand what I'm going to say right now. Every woman is a mother, and any woman can be a mother at any age. There are different ways of becoming a mother. There will be a stage when you can no longer become a mother through pregnancy, but you can become a mother through surrogacy, but you can become a mother through adoption. You're still a mother. There is no difference. So there are some women that will become mothers without going through the process of pregnancy. There are even some younger women that will still become mothers without going through the process of pregnancy. There are some women that have hostile womb. There are some women that have medical problems that are not compatible with pregnancy. So we're not going to take them through pregnancy because pregnancy can put their life in danger. Remember that, first of all, for you to be a mother, you have to be around. You have to be alive. Okay? How many times should a woman go through IVF procedure? So there is no hard and fast rule in the number of times. But here's the deal. The more you're exposed to exogenous hormonal drugs, the more you're predisposing yourself to a couple of medical problems, including developing cancer. So it's a game of knowing where to do the cutoff point. Because the more you go for exposure to stimulation and all those drugs, the more you're exposing yourself to a lot of risk factors. So in the literature, we don't have a place they say, oh, once it's 10 times, you stop. But it's at the discretion of your doctor and your own discretion. So personally, if you ask me, I wouldn't want you to go for IVF more than 4 times, personally. If the 4th one fails, switch gear. Either you use donor eggs or you go for surrogacy. Because the problem is, it's possible you might start looking for a baby in your 30s, and you continue looking for a baby in your 40s, and you're tending towards 50s. As you're getting older as a woman, you are already at risk of developing so many problems, including cancer. So when you now predispose yourself to those risk factors, the possibility of you developing cancers will increase. For example, you might have a familial history of breast cancer genes you didn't even know, and you definitely want to become pregnant, and you keep going back and forth. There are some women that go for IVF twice in a year, which personally I don't subscribe to. So the more you go there and expose yourself to all those hormonal drugs, the more your cancer genes will be modulated. So if you're supposed to develop breast cancer in your 70s, you develop breast cancer in your 40s because it's in your family. So there are some women that have cancer genes. Whatever happened to your mother will likely happen to you. Whatever happened to your father will likely happen to you. So that's why we preach chronic medical conditions control and prevention. So let me give you an example. If you're a daughter, if you're a girl, if your daddy had hypertension and diabetes, you have a very big risk factor of developing hypertension and diabetes. Daughters tend to take through their paternal negative genes. So what your father had, you can have it easier compared to your brothers. Now, on the flip side, whatever your mom had as a man, possibility you're going to have it is very high. So by default, if you guys have a family history of hypertension, of diabetes, of obesity, of cholesterol problem, of heart problems, of cancer, be careful. Live a healthy life, because possibility you're going to develop them is very high. Okay? All right. Beautiful questions from Chinyere and amazing. I think we've come to the end. It's 22 minutes. So if we don't have any other questions, then I will see you guys tomorrow. So Chinyere, do you have any other question? Oluchi KK, are you attending the event tomorrow? I think 2 or 3 more people joined. If you still have questions, please ask. I wouldn't mind spending extra 3 minutes. But if not, we're going to go through Facebook and we're going to go get started. Okay? Any other question? Besides the admin, how many people will attend the masterclass tomorrow? If you're planning to attend the masterclass tomorrow, just raise your hand or type it in the comment section. Anybody? Okay. So it looks like it's a dry tap. So thank you so much for joining me. The next YouTube presentation will be on Tuesday. So Tuesday will be 6:30 p.m. Eastern time, which will be 11:30 p.m. Nigerian time. We're going to find a good topic. We're going to talk about a topic. The next Saturday, definitely, we're going to talk about another topic by 3:30 p.m. But thank you so much for coming. If today is the first time of attending my event, thank you for finding time to attend. Please, before you go, click on that subscription button. Set your notifications to tell you when I normally come live. My clinics are standard, 3:30 p.m. Eastern Time US on weekends, then 6:30 p.m. on Tuesdays. Now, remember that on Sunday, the 5th of November, we're going to fall back. So all the people in America will lose 1 hour. So we're going to adjust our time so you don't miss any of the events. But the event tomorrow is still going to be 9 p.m. Nigerian time, 4 p.m. Eastern Time US. So thank you so much for coming. I appreciate you guys. And if you're in our Facebook, I will see you shortly. Until then, God bless you and enjoy the rest of your weekend. Bye-bye for now.